Hello and welcome to today's class, which is focused on sleeping better during pregnancy, in particular hip and shoulder relief. So all you need for today is your mat. You also may want a cushion or a block, or I'm very lucky to have a bolster here if you've got one of those, just for when we come into a supported child's pose position. Now, if you're around 14 to 16 weeks pregnant, then you can do these exercises either seated or laying on your back. If you find that laying on your back is uncomfortable, then stay in seated. I'm around 16 weeks pregnant at the time of filming. I still feel okay on my back, but if it makes you feel unwell for any reason, or you just don't feel comfortable in terms of pressure, then stay seated, and that is absolutely fine. We're going to come and take a seat, or if you're comfortable lying on your back, then please do. We're just going to focus on the breath to start with. So come into a seated position, placing your hands onto your legs, just closing down through the eyes. And we're just going to focus on the breath, breathing in through the nose and out through the mouth. Nice big expansion through the ribs, the lungs, the belly on the inhale. And drawing it all back in on your exhale. So we're getting ready to wind down and go to sleep. So we just want to take a little bit of time to focus on the breath. Good. We're going to take one more breath. Lovely. Gently opening up through the eyes. And we're just going to come into a bit of a hip and glute stretch just to release some of that tension that you might be holding. So if you're going to do this in seated, you're going to have your feet on the floor with the knees bent, hands on the floor behind you, and we're going to take the left foot up and over the right knee. If you find that you haven't quite got enough space because of your bump, you can always bring a bolster or a cushion behind you just to provide a little bit of support. Make sure you're not laying flat on the floor. And then you can still come into this stretch. Again, if you're comfortable on the floor, that is absolutely fine. And then we're going to release that leg and change sides. The foot comes up and over the knee. You can support that stretch in whatever way feels comfortable for you. And we're not going to be here for too long. We're not going to hold these stretches for too long, because we do get a little bit more elasticity in the ligaments during pregnancy. So we don't want to overstretch. Lovely. We're going to come and bring that leg all the way back down and relax. From here, we're just going to gently come and roll over onto our side. So take your time to get there. If you want a cushion under your head, then please do. You can lengthen your arm out along the floor. You can come and rest your head in your hand. Completely up to you on what feels more comfortable. We're going to bend both of our knees. Knees are a little bit further out in front and our feet are lined up with our bum. And we're going to be taking some really small clam type movements. So we're not looking to lift the knee as high as we can and really, get that burn into the side of the leg like we sometimes do with clams. We just want this to be nice and supported, activating through the glute a little bit and into the hip. We just want this to feel nice and supported, activating into that hip a little bit. So we're going to keep the feet together and just gently, really small, lift and lower through that top leg. My hips are already aching today, so this is a very small movement for me, and that's okay. Stay with the breath. Inhale at the bottom, exhale to lift. Good. Keeping those hips stacked. We're taking two more. Good. relaxing down, just taking a little breather there. And then we're going to push ourselves up to seated. So just use your hand, your top hand, to push yourself all the way up. And just come and take another seat before we do the other side. We're going to take the arms out really nice and wide, stretching into the chest, and then come and clasp them behind the back. Push down towards the floor with those arms and the hands. Shoulders roll back, and then I just want you to see if you can lift the hands away from the body and lower back down. We lift and lower. Good. We're going to take 4 more. Stay with the breath. Last 2. And last 1. Perfect. Release the hands. Come on to the other side, where we're going to come back into our clamps. Come all the way down. However it feels comfortable for your head and your hand. Bringing those knees together, feet together. And we're just going to start to lift and lower that top leg. So we're always advised to sleep on our side during pregnancy, preferably the left side because it increases the blood flow to the baby, but sleeping on the right side is also absolutely okay. So don't panic if you wake up in the middle of the night on your right side. You might find as you're here doing this class that you're getting a lot of aching into the hip, maybe into the shoulder when you're spending a long time sleeping on one side. So there are things that you can do. You can come and bring a pillow in between your knees and your ankles, which just help keep your hips in alignment. You can also bring a pillow or some kind of other support underneath your bum as that starts to get bigger. The other option is to hug a pillow to support your top arm and hopefully take that aching out of the shoulder. We've got 2 more. Good, last one. Lovely. Come and push yourself up nice and gently. Come and get your support, whatever that is. Mine's going to be this lovely bolster. And we're going to take the feet together, toes a little bit wider. So we want to create enough space for the bump here. We're then going to bring the hands or the arms onto the cushion or whatever support that you have. And we're just going to lower the upper body into a child's pose. So this is a nice supported stretch for you. It means you can still come fully into that stretch, into the hips and into the back without putting pressure through the bump. And again, we're not going to be here for too long. Not looking to overstretch. Just let your body relax down. And then just taking your time, coming all the way up. Bring the knees in. And that is your class for better sleep during pregnancy. Now you can do this really quick routine just before you go to bed, just getting a little bit of relief through the hips and the shoulders. And you can use those other support tips as well about using pillows and cushions to support yourself during sleep to hopefully take away those aches that you might be feeling. So I hope that was useful and I look forward to seeing you again soon.